Pathological conditions, the nervous system. Alzheimer's disease, defined as a progressive, extremely debilitating deterioration of a person's intellectual function. Amyotrophic lateral sclerosis, also known as ALS, severe weakening and wasting of the involved muscle groups due to the decreased nerve innervation, usually begins with the hands, progresses to the shoulders, upper arms, and then legs. As you can see here is a picture of Lou Gehrig, which is who the condition is usually related to, Lou Gehrig's disease. Anencephaly. Anencephaly is the absence of the brain and spinal cord at birth. It is a congenital disorder, which means they are born with it. Condition is incompatible with life, which means the child usually expires shortly after birth. Bell's palsy. Temporary or permanent unilateral weakness or paralysis of the muscles in the face. Brain abscess, accumulation of pus located anywhere in the brain tissue. Carpal tunnel syndrome, pinching or compression of the median nerve within the carpal tunnel. Also, inflammation and swelling of the tendons cause intermittent or continuous pain. Question, true or false? The breakdown of the word anencephaly, and without or not, encephal, skull, the Y makes it a noun. False. Cranium is the skull. Anencephal means brain. Cerebral concussion. Brief interruption of the brain function, usually with loss of consciousness lasting for a few seconds, usually due to a blunt trauma to the head. I want you to know the difference between a concussion and a contusion, which we're going to cover next. So cerebral contusion is a small scattered venous hemorrhages in the brain, bruise of the brain tissue, and occurs when the brain strikes the inner skull. So a good way to remember this is a concussion affects the entire brain. A contusion is kind of like a bruise on the brain. It affects one specific area. Cerebral palsy. Collective term used to describe congenital brain damage that is permanent but not progressive, characterized by the child's lack of control for voluntary muscles. There are 4 types of this. We have spastic, which is damage to the cortex of the brain, is evident by tense muscles, very irritable muscle tone. And then we have ataxic palsy, which is damage of the cerebellum, affects your equilibrium. Athenatoid, that is damage of the basal ganglia. It causes sudden jerking. Rigidity, which causes the child to be in a continual state of tension. Kind of like when you have a child who's learning to walk, and if they're standing straight up on their legs, sometimes they're up on their toes, and they have a hard time relaxing those muscles to move because they're learning it, but that's called rigidity. Mixed cerebral palsy is a combination of the 3 types. Cerebrovascular accident, also known as a CVA. It is death of a specific portion of the brain tissue, results in ischemia to the area of the brain, and it is also called a stroke. So you need to know that a CVA is a stroke. Cerebrovascular accident continued, causes transient ischemic attacks, also known as TIAs, which are a mini stroke. So you need to know CVA is a stroke, and TIAs are mini strokes. Remember, if it's TIA, it's mini stroke. TIAs, mini strokes. All right, cerebral thrombosis occurs largely in individuals older than 50. Cerebral embolism is embolus causes an occlusion. Remember, embolus is a blood clot that has been dislodged and is able to move around. Cerebral hemorrhage is when cerebral vessels rupture. Degenerative disc disease. Deterioration of the intervertebral discs, usually due to constant motion and wear on the discs. Encephalitis is inflammation of the brain. Remember, itis is inflammation. A virus enters the central nervous system when a person experiences a viral disease such as mumps or measles, or through a tick or mosquito bite. Epilepsy, syndrome of recurring episodes of excessive irregular electrical activities of the central nervous system called seizures. Remember that lepsy is seizures. Grand mal seizures, epileptic seizures characterized by sudden loss of consciousness and generalized involuntary muscular contractions, may be preceded by an aura. Vacillates or alternates between rigid body extensions and an alternating contracting and relaxing of the muscles. also known as tonic-clonic seizures. Petit mal seizures, small seizures in which there is a sudden temporary loss of consciousness, lasts only a few seconds, is also known as an absent seizure. Someone experiencing this could also have a lapse in a conversation. It can be staring across at them, having a normal conversation, and it looks like their eyes kind of look farther into the distance, and they come back. They might ask you what they said, but they will actually not be aware that they just had a seizure. So that is why it's called an absent seizure, because they're not aware that they had one. Guillain-Barré syndrome, acute polyneuritis of the peripheral nervous system, in where the myelin sheaths on the axons are destroyed, resulting in decreased nerve impulses, loss of reflex responses, and sudden muscle weakness. Usually follows a viral gastrointestinal or respiratory infection. Question: true or false? A cerebrovascular accident is a misfiring of the electrical pulses in the brain. Think of your word, cerebrovascular accident. False. Vascular means vessel, so this involves a lack of blood flow to the brain. Alright, headache, also known as cephalalgia. Pain within the cranial cavity varying in intensity from mild to severe, may be chronic or acute, may occur as a result of a disease process, or may be totally benign. Migraine headache. Reoccurring, pulsating, vascular headache usually develops on one side of the head, characterized by slow onset, may be preceded by an aura during which sensory disturbance occurs. I know some people who have migraines, they have a sensitivity to light, also to sound, as well as like if they're experiencing movement as well. Cluster headaches, headache occurring typically 2 or 3 hours after falling asleep, described as an extreme pain around one eye that awakens the person from asleep. Tension headache. Headaches that occur from long endured contraction of the skull muscles around the face, scalp, upper back, and neck. Epidural hematoma, collection of blood located above the dura mater and just below the skull. There is arterial bleeding. Subdural hematoma, collection of blood below the dura mater and above the arachnoid layer of the meninges. With this, you have venous bleeding. Herniated disc, rupture or herniation of the disc center through the disc wall and into the spinal canal, causes pressure on the spinal cord or the nerve roots. Huntington's chorea is inherited neurological disease characterized by rapid, jerky, involuntary movements and increased dementia. It is progressive and degenerative disease. There is no cure. Question: what type of headache would be most common in a profession such as medical transcription, which involves being in the same position for an extended period of time? A, cluster, B, migraine, C, tension, or D, all of the above. Answer is C. It's very important to take time to stretch these tense muscles as often as possible to minimize more pain and injury. Hydrocephalus. Abnormal increase of cerebrospinal fluid in the brain that causes ventricles of the brain to dilate, results in increased head circumference in an infant with open fontanelle, and it is a congenital disorder, which means they're born with it. Intracranial tumors. Tumors occurring in any structural region of the brain, may be malignant or benign, classified as a primary or secondary, named according to the tissue from which they originate. Primary intracranial tumors. Tumors that arise from gliomas and the meninges. Gliomas are malignant glial cells that are a support for the nerve tissue. Glioblastoma multiforme, most rapidly growing from the gliomas. Then we have our astrocytomas, tend to invade surrounding structures, most common type. Epididymomas are occurring more commonly in children and adolescents, usually encapsulated and benign. Metastatic intracranial tumors, which are secondary, a tumor occurring as a result of metastasis from a primary site such as the lung or breast. Meningitis, acute bacterial, serious bacterial infection of the meninges. Can have residual debilitating effects or even a fatal outcome. Must be diagnosed and treated promptly with the appropriate antibiotic therapy. Question: true or false? A biopsy of a tumor in the brain shows cells compatible with breast tissue. This means it is a primary tumor. False. Since the tumor did not originate within the brain, it is known as a secondary tumor. Multiple sclerosis, also known as MS. Degenerative inflammatory disease of the central nervous system attacking the myelin sheath in the spinal cord and the brain. leaves the area sclerosed, or also known as hardened or scarred. There is no cure. Myasthenia gravis, chronic progressive neuromuscular disorder, causes skeletal muscle weakness and fatigue, and occurring at different levels of severity. Narcolepsy, rare syndrome of uncontrolled sudden attacks of sleep. Main features of narcolepsy are daytime sleepiness and cataplexy. Sudden loss of muscle tone. Neuroblastoma, highly malignant tumor in the sympathetic nervous system. Most commonly occurs in the adrenal medulla with early metastasis to the liver, lungs, lymph nodes, and bones. Parkinson's disease, degenerative, slow progressing deterioration of nerves in the brain stem's motor system. Gradual onset of symptoms such as stooped posture, which is the body flexed forward, bowed head, shuffling gait, pill rolling gestures, and mask-like facial appearance. Peripheral neuritis, inflammation of one or more peripheral nerves. Effects are dependent upon the particular nerve involved. Poliomyelitis, infectious viral disease that affects the ability of spinal cord and brain motor neurons to receive stimulation. Virus enters through an upper respiratory tract. Muscles affected become paralyzed. Post-polio syndrome, progressive weakness occurring at least 30 years, yes, 30 years after the initial poliomyelitis attack. You can suffer from poliomyelitis, which is this one, and then 30 years after you could actually get post-polio syndrome. Bry syndrome, acute brain encephalopathy, along with fatty infiltration of the internal organs, may follow an acute viral infection. Occurs in children under the age of 18, often with fatal results, linked to aspirin administration during a viral illness. Shingles, also known as herpes zoster, acute viral infection characterized by inflammation of the underlying spinal or cranial nerve pathway, producing painful vesicular eruptions on the skin along the nerve pathways, seen mainly in adults. Here is an image of what shingles looks like, and you can see it following the pathway of the nerve. Skull fracture, depressed. Broken segments of the skull bone thrust into the brain as a result of direct force, usually a blunt object. Manifestations depend on the section of the brain injured and the extent of the damage to the underlying vessels. Spina bifida cystica, back portion of the one or more vertebrae not closed normally, and a cyst protrudes through the opening in the back, usually at a level of the fifth lumbar or the first sacral vertebrae. Congenital defect of the central nervous system, so they are born with it. Question: there have been 3 disorders mentioned so far that affect only the peripheral nerves. They are Parkinson's, poliomyelitis, and Bell's palsy. B, myasthenia gravis, shingles, and carpal tunnel syndrome. C, Bell's palsy, carpal tunnel syndrome, and peripheral neuritis. Or D, shingles, peripheral neuritis, and poliomyelitis. Answer is C. Bell's palsy affects facial nerves, carpal tunnel affects the median nerve in the forearm, and the peripheral neuritis affects one or more. Meningocele, cyst-like, covered with skin or thin membrane protruding through a bony defect in the vertebrae. Contains meninges and cerebrospinal fluid. Meningomyelocele, cyst-like sac covers with skin or thin membrane protruding through the bony defect in the vertebrae that contains meninges, cerebrospinal fluid, and the spinal cord segments. Spina bifida occulta, congenital defect of the central nervous system in which the back portion of one or more vertebrae is not closed. A dimpling over the area may occur. Paraplegia, paralysis of the lower extremities caused by severe injury to the spinal cord in the thoracic or lumbar region. Results in a loss of sensory and motor control below the level of the injury. Quadriplegia, paralysis of the trunk, legs, and pelvic organs. Partial or total paralysis of upper extremities due to severe injury to the spinal cord between the 5th and 8th cervical vertebrae. The level of vertebral involvement determines the severity of the motor and sensory impairments. Tay-Sachs disease, congenital disorder caused by an altered lipid metabolism resulting from an enzyme deficiency. Accumulation of this type of lipid occurs in the brain, leading to progressive neurological deterioration with both physical and mental retardation. Occurs most frequently in families of Eastern European Jewish origin. Trigeminal neuralgia, or Dick-LaRue, short periods of severe unilateral pain that radiates along the 5th cranial nerve, trigeminal nerve. Heat, chewing, touching of the affected area activates the pain. Question: true or false? Quadriplegia can also be called tetraplegia, which also means 4. True. However, quadriplegia is the most common and widely used term. That concludes part 2. Please progress on to diagnostic techniques, treatments, and procedures.